Now, as Guinea battles an Ebola outbreak, countries bordering the West African nation are on high alert as they prepare themselves for a possible outbreak. The World Health Organization Regional Emergency Director, Dr. Salam Gay, joins me now to talk about this. Dr. Salam, good evening and thank you for your time tonight.
Good evening, sir.
How critical is the situation right now in West Africa as far as the resurgence of Ebola? And what are the drivers? What has led to this? Because this has not been, of course, the case, at least in the last 5 years.
Thank you very much. So far, we are in the beginning of an outbreak where we have reported so far 9 cases. And among those 9, there is 5 that are dead. And actually, the situation is kind of calm, but it can be worsened at any time.
When you say it can be worsened at any time, I mean, if we're looking at 9 cases right now, how could that scale and where could that curve go?
You know, those 9 cases so far, we have registered over 300 contacts, which means that they have been in contact with those cases. And nobody knows exactly among those 300 contacts who's going to develop the disease or not. And if we are following those contacts, tracing them, and when they develop the disease, we detect them and isolate them, we can control the outbreak. But for one reason or another, we are not able to control those contacts. They may spread the disease. And as we know that people move, they may spread it in other areas of the country or even in neighboring country.
Yeah. What do we know about the origins then of this second outbreak? Do we know where it is stemming from?
The second outbreak, we know that it is Ebola Zaire, and it may be related to the past outbreak, as you see that the outbreak that happened 5 years ago was in the same area, but also it may be a new outbreak. We don't know yet, and the samples are sent to Dakar for sequencing, and the sequencing may give us a clue about where it came from.
Yeah. Now,
we are so far also doing some epidemiologic investigation.
What are the complications that come with dealing with a pandemic that is already engulfing the whole entire world and this outbreak of Ebola that has just now been picked up in West Africa?
Yeah, you know, the challenge is in a time of COVID-19, there is already a lot of funding that was spent and fatigue among people fighting COVID-19 when Ebola outbreak happened. It's gonna add to that burden to the countries. And also, as you may know, there is a problem of shipment, and also the same tools that are used to fight Ebola are those that we are using also to fight COVID, and there is some competition for resources.
Yeah. World Health Organization seems to be pleased with the level of readiness. In fact, for 6 countries, they're putting it at 66%. What do you look at when you are assessing the level of readiness for an outbreak like the Ebola outbreak in terms of the nations, what they've put in place and the systems that will assist?
Yeah, we have a harmonized tool to assess the situation of a nation in terms of readiness. And that harmonized tool will look at different parameters. It is dozens of parameters. But among them, for example, if it exists a rapid response team, if they are ready for vaccination, we're going to look for the cold chain. And also we may be looking for the treatment capacity and surveillance capacity. We are working closely with the 6 neighboring countries, and each of them has conducted a self-assessment of their readiness. 2 of them are more or less ready, 2 are not ready, and 2 are in the middle.
As far as the vaccines that are required, we know the United States has sent some already to Guinea. What other stocks are you awaiting as far as the vaccines are concerned?
As far as the vaccine are concerned, we have received already 11,000 doses of vaccine that was on the stockpile of WHO. And we are expecting around 8,000 doses that is coming from the United States. And it is about 20,000 doses that are ready now to be used in the outbreak and using the strategy of ring vaccination.
And what would be the targets that the WHO has set for themselves for the vaccination?
For the vaccination, the ring vaccination will vaccinate anybody who has been in contact with a patient and also anybody who potentially is in contact with a contact. So the vaccination will vaccinate the contact and the contact of contact. So before they develop the disease, they will be developing the immunologic resistance, and hopefully they will not develop the disease, or if they develop it, it will not be very severe.
So what are the lessons then that have been learned from the history of the Ebola outbreak that are being applied now in terms of the swiftness of the response and readiness, and what needs to be put in place?
When you just introduce, you tell that the readiness of the countries are at 60%, which was a lot worse. Before the first outbreak, it was under 10%. And actually, almost all the countries have a rapid response team, has some detection capacity, testing, and treatment capacity. They are not all ready, and we are working for particularly those who are not ready to try to develop the most important aspect of readiness.
Right. Now, the WHO has dispersed about $1.2 US to support the response in Guinea and to reinforce Ebola readiness. Is that enough, or are there more resources that are going to be required here?
Absolutely not. It is not enough. It is $1.25 million that was given to Guinea, $500,000, and the rest was distributed among the 6 neighboring countries. It is not enough, and we are working with all the partners, including the UN system, which is in the process of freeing $15 million for all the partners, including WHO. And we will need also the contribution of other partners, not only for funding, but also to come and work in the field with us, or to provide some technical support to the country.
Dr. Salam, appreciate your time, and thank you very much for sharing that information with us. WHO Regional Emergency Director, Dr. Salam Gay there, outlining for us the vaccination program and the readiness of the various countries in West Africa.